So my name is KC Arnold. I'm an adult acute care nurse practitioner. I'm board certified in advanced diabetes management. I own the Diabetes Center in Ocean Springs, and we're a 3-nurse practitioner, and we specialize in helping people with diabetes in our community. In the patients that use Insulia, I see they're a little more engaged. If they get it and they start putting in their blood sugars and the dose is being titrated, they seem to be more on top of what they're doing in terms of their day-to-day care. So now I can see exactly when they went up and the exact effect of that insulin dose on their blood sugar fasting.
I have had type 2 diabetes for probably 12 years. I started feeling terrible, sleeping all the time, and my sugar levels were horrible. So when I started seeing Casey, and she was insisting that I do this every day, she put me on Insulia, and so we could keep closer track. She could see it at real time. Instead of having to wait 3 months for me to come back in for visits, I could call her if I was having problems or if I saw a fluctuation, and she could just pull it up online and have a look at it.
It is challenging to try to calculate. I think Casey told me one time how to try to do it, but I couldn't do it. That's why insulin was so important for us. I guess she kind of knew that I didn't want to or able to calculate it, so that's why she set me up with the app.
So when I have a patient who's a good candidate for Insulia, they're on basal insulin, they need titration, most of the time they get very excited about using the technology because I'm a part of their care day to day, and I can look at their information whenever they need me to. Some patients are a little afraid of technology. They don't have a smartphone. So those patients will show them the internet option. And if I have a patient that really doesn't want to do the tech, but somebody else will do it for them, the input of the data, a husband, a wife, a loved one, then we've had some very successful cases of that, of giving patients other ways of doing it.
We started using it probably about 2 months after he started the insulin. And it just made it so much simpler, because when his blood sugar would go up high or below, I would have to call them to see what to do. I would not like to be without Insulia. Now that I've gotten used to it, it makes it so much easier.
Overall, I'm getting a much higher rate of people titrating their insulin, and that's both titrating it up and down, which is really exciting for me to see that. If your patients are not titrating their basal insulin, you need to consider this tool, because we need to help patients become more compliant with doing the titration schedules. I've seen a reduction in A1Cs, better compliance with testing their blood sugars, and just the ability to see those blood sugars in between visits. I think those are the reasons why Insulia is so helpful here in my practice, that is just helping people with diabetes.